How are you?
I'm fine.
Man, okay.
How are you?
I'm okay. I'm okay. See, I know we've had a little bit of a difficulty last time, so let's get on with it. Okay. Now, introduce yourself to my audience. Tell them who you are and what you do.
Okay. So, hello everyone. I am Umaru Yila. I'm a medic, the founder of Docxplorer. That's currently what I say, that's how I introduce myself these days, because Docxplorer currently is my passion, is what I do. And for what Docxplorer is, it's a platform for medical students and healthcare professionals. When I say medical students and healthcare professionals, I mean everyone that is under the umbrella of the healthcare field, whether medicine and surgery, nursing, physiotherapy, pharmacy, radiography, you can spread the list, paramedics. So we basically have three core aspects, which are we help to solve the educational resource challenge that's given to medics here in Africa, because we believe that our curriculum is a bit outdated. Now, not in terms of what they teach you, because we have very good clinicians that come out of Nigeria, West Africa, and Africa at large. But the training has to do with how you treat patients, how to handle emotions, and becoming a better general medical or healthcare practitioner generally. Then another thing, one of our other core aspects is mentorship. So we believe that in Docxplorer, we believe that as a healthcare professional, if you want to grow up the ladder, you need to learn how to be teachable. So we believe that the best way to go is through a tailored path where people are there for you to teach you, to train you in how to become the best career professional that you can, or to create the best path for your career as it's out there. Then lastly, we also believe in networking. So we have achieved so much as a community, we have achieved so much as a people, and it all comes down to networking, how fast you can get things done because of your social network. So we believe in building the right social network, collaboration in order to get projects done. So with this, we have been able to, with these three things, we have been able to do a lot in the healthcare community, improve ourselves, grow, gotten things that were out of reach before, and connected with so many people all from all around the world. And we've garnered respect in the healthcare community, and we have gathered credibility too in the healthcare community. So we're teaching people how to do research. Like normally in Nigeria, we'd see that research is something that is far off. It's just something that you go to school to do. But then in Docxplorer, we believe that research is something that is necessary for solutions to be provided in any given community or any part of the country. So it's all about we're teaching people how to think big, how to create solutions, and we're also empowering too by connecting them with people who can make these things happen and come to life. So it's a whole lot actually, and that's the basis of our project. But you see, this is it's a very ambiguous thing. So there's a lot that comes in. Anything that comes our way, anything that comes our way that is in line with our values, we accept. Anything that is not in line with our values, we don't accept. So that's how we have been able to build what we are currently doing now. So yes, that's basically Docxplorer in a nutshell.
Okay. So tell me, when did this start, and how far are you intending to go with it?
Okay. Now, so it has always been something for me, because I would say I'm a very jovial person. I know how to communicate well. I know how to discuss. I think it's one of my key talents, or one of my key attributes, knowing how to network, how to get things working, and not slowing down to make sure things happen. So these attributes have made me make friends over the years. I go to a lot of conferences, go to a lot of summits. I see, if you talk to the average Nigerian medical students or healthcare professionals that are starting their career, they're always looking at how to make big changes around the world, how to support SDGs, how to work with the big dogs, I'll put it like that, the UN, WHO, in order to bring impact, make impact and all that. And from a young age, I have been able to participate in a lot of things. In 2022, I registered to be under the UN's Best Diplomat Assimilation Program. I got in. And I won a MasterCard pitch competition. So I would say I was in 2020. So I was a bit exposed to some of these global opportunities. And then I read and I research a lot. So I talk to people and then they're saying they want to do these things, but then I see that the curriculum is not enough. And I tell them, oh, you can do this, you can do this. So I have a lot of people that come around me and they're asking questions on what do you think is going to be the best career path? So I had some of those questions and I see that these questions come to me easily, or like the answers come to me easily because I've done the work, I've done the research, and I know the people too as well. LinkedIn also played a very big factor because I built a very strong network of healthcare professionals all around the world. And I discuss with them on a daily basis. I would say a daily basis because it's quite a huge network. There's always one thing happening here in the US, in Canada, and contributing to discussions. Also, I also see your contributions to discussion. So you see, it's an ecosystem. So I noticed I had this information and I knew the best pathways for certain clinical and non-clinical healthcare career paths. So this was part of it, but the icing on the cake was